Hello and welcome back. This is Dr. Kevin Connors. We are on the second half of our brain drain presentation. So, brain drain. How do we remove the inflammation that's driving us crazy? The inflammation that's in our brain that is causing neuronal pathways to be blocked. That's causing all sorts of symptoms. So, these two presentations are not at even close to covering everything that we need to cover. So there'll be a lot of presentations on this, so stay tuned. Last week we discussed the lymphatic system of the brain, and you had that beautiful picture of it. It's because it's non-existent. And how these wonderful Dutch scientists discovered that there's actually a glymphatic system to the brain. When the glial cells contract while we sleep, and cause this flooding of fluid to go across our brain and just clean it all out. This tissue profusion across the brain through from the cerebrospinal fluid that just washes all that tissue exudate, all that waste products away. And so sleep is the number one way you're going to clean your brain. That's really good, but I'm really sick and I can't sleep all day. So understand we are making the assumption here that you're getting rid of the cause. So that's a lot of other pieces to this puzzle that we talk about in this whole entire program. But now we're trying to just clean it out. Now that we've gotten rid of the cause, or we're in the process of killing the Lyme disease, or taking out the heavy metal toxicity, and we're in the process of healing the blood-brain barrier. That's going to be a whole multiple presentations in itself as well. But sleep is a major way that you do so because you are decreasing the sympathetic nervous system tone. So remember, there's two sides of your autonomic nervous system. So remember we talked about it's an anti-adrenergic effect of sleep. So, and we said that the sleep actually causes a parasympathetic effect in your brain. So that's what we're going to talk about now. How can we create this increased parasympathetic, decreased sympathetic tone in my brain? And we really want that in our body. So when we test patients in our office, we test for that. There's a very specialized test that we can measure the autonomic nervous system and see from a level of where are you at from a complete tone level. Are we hyper both of them, or hypo both of them, or are we hypersympathetic or hyper parasympathetic? And really, if I have any patient that is suffering from any chronic disorder, I'd really like them to be a little bit on the parasympathetic dominant side, because it is the parasympathetic nervous system that really is the healing nervous system that stimulates an immune response that helps with detoxification, digestion, sexual function, rest, and relaxation. So what it does to specific organs, the sympathetic increases the heart rate. Well, think about it. Sympathetic is the fight or flight. What do I need if I'm going to run away from a polar bear? I need my heartbeat really strong. I need my force of contraction really high. I need to constrict my blood vessels so I can shunt blood to the extremities really quick, because I got to run really fast away from this polar bear. My lungs need to bronchodilate so that I can get oxygen into my lungs as quick as possible. And my body needs to be able to fight. So I need everything that is not necessary for current survival to basically shut down. And that is my parasympathetics. So my parasympathetics would slow my heart, would decrease the force of contraction, would be in relaxation. I would have bronchial constriction because I don't need that air going into my lungs so quickly. I would have an increased gut motility. So when I eat a big meal, I get tired because my parasympathetics kick in to digest that food. When I'm healing from a disorder, my parasympathetics are working to kick in my immune system. So there's normally should be a balance between these two things, but when I'm trying to heal, I really need to make sure that I'm not already stuck in a sympathetic dominant state. And when I need to clear inflammation out of my brain, I do not want to be stuck in a sympathetic dominant state. So how are we going to deal with decrease in sympathetic dominance? Well, this wonderful stress technique here is just to, it's a joke. Don't bang your head on your computer screen. But there's all sorts of different stress techniques. How are we going to decrease stress? How are we going to, maybe change our job environment, work on relationships that are causing stress? There's just too many to go over at this time. You need to seek counseling if that is an issue in your life. If you have constant stress from a dysfunctional relationship or dysfunctional job, you need to seek help from that, and don't hesitate to seek professional help. We need to understand our spiritual position, so we talk a lot about that in my quiet place. I do a lot of preaching, so you get to listen to me talk about who you really are in Christ as a believer, and really understanding that and drilling that into our heart, because most of us aren't raised in a perfect household. We had parents that had issues, and we weren't, that wasn't built into us, and so we need someone, different things, to build that into us. That's what the whole purpose of the quiet place is. We also need to fix our gut biome, and that is a number of presentations on itself as well, because if our gut is inflamed, it is going to cause inflammation in the brain, and it's going to increase the sympathetic tone of the brain. So gluten sensitivities, heavy metal toxicities in the gut, other toxins in the gut, parasitic issues in the gut, all increase the sympathetic tone of the gut and increase the sympathetic tone of the brain. So any leaky gut disorders and such are going to increase the brain sympathetic nervous system tone, and you're not going to be able to flush. You're not going to get adequate sleep. You're never going to get into that deep sleep that you need in order to flush your brain. And during the day, you're going to be constantly flooding inflammation in your brain. Also, looking at changing the brain's chemistries. So there's neurotransmitters that communicate from one neuron to another, so the neurons don't touch each other, and they communicate through that little gap called a synapse, and these neurotransmitters pass information to the other neuron very quickly. When there's an imbalance in neurotransmitters, then there's going to be an issue there. The immune response. Remember I said there's certain cells in the brain that control an immune response. Those are the microglial cells. If there's an immune issue in the brain, meaning an infection in the brain, like a mild Lyme disease that's ramped up constantly over time in the brain, there's going to be the next line, inflammation. So we want to control the source. We've got to get rid of that cause in order for any of this to work. Also, neurofeedback works wonderful to balance the brain and to decrease the sympathetic tone. So in our office, that's what we always look at. If a person has a hypersympathetic tone, or both the sympathetic and the parasympathetic is in a hyper state, that would be in what's called a limbic state. Neurofeedback is the treatment of choice for that. So that can help calm down the brain waves and help healing to occur. So we want to look at how we're going to mimic sleep. So we can mimic sleep with some specific nutrition. So the specific nutrition that we would use on a patient to mimic sleep would be that same thing that we're going to use on a high blood pressure patient to decrease that sympathetic nervous system tone. So they are in a classification of nutrients that are called central alpha agonists. These central alpha agonists, there's drug classification that are CAAs. We want to use natural ones that will help reduce the sympathetic nervous system tone. We have a list of them there: taurine, vitamin K, B6 and C, zinc. I'm not going to read what you could read there. But those are things that we would give a person, and there's different combination products that are out there. I'll show you a couple in a second that will help lower that sympathetic nervous system tone. Because typically a person will have higher than average blood pressure if they're in a sympathetic dominant state. There's also natural ACE inhibitors. Hawthorn is an herb that's a great natural ACE inhibitor. Pomegranate is a great natural ACE inhibitor. Matter of fact, there was a study done about a year and a half ago that they gave high blood pressure patients simply 8 ounces of pomegranate juice, just the Pom brand pomegranate juice a day. They drank 8 ounces of pomegranate juice, and it was equivalent of taking 10 milligrams of the typically given ACE inhibitor medication. Unbelievable. Omega-3s, melatonin, pycnogenol, these are all good decreasers of sympathetic tone. Now, obviously, with any of these, you got to make sure if you're not Th1 or Th2 dominant, you can't stimulate that system if you are dominant in that system. Here's 2 products that we use that have these things in there. HTN, that stands for hypertension complex, and Paleomil that we use in our office that have those things, but there's a lot of products on the market that have those same things. Your take home for this is to make sure your sleep length and quality is the best that you can produce. You don't want to be shortening your sleep to think that you're going to get more work done. You want to make sure your quality of sleep is there, and I have a whole other presentation on how to improve that. You're emotional and spiritually, that you're grounded, that you take away issues that are emotional stressors, that you make sure you get counseling for those. Healing your gut, different neural toxicities, make sure that there isn't a toxin that you're currently being exposed to. Otherwise, you could do all this stuff and you always have this ramped up inflammation. Neurofeedback is something that is so valuable to look into. We've just seen miracles in our office with that. And using some nutrients to mimic your sleep. So those are good pieces to the puzzle. Now we go in depth with all of these with future presentations, so stay tuned. I hope this was helpful. Listen to it again if you have to. Thanks. Have a great day.